This lesson is going to be over pediatric daily maintenance fluids and pediatric calories. We're just going to work one problem of each. So we're going to start out with daily maintenance fluids. So when we're calculating daily maintenance fluids, this is what we're going to need to remember. The first 10 kilograms are going to be multiplied by 100 mils. The second 10 kilograms multiplied by 50 mils, and the remaining kilograms are multiplied by 20 mils. And this will make sense in just a second. So when we calculate daily maintenance fluids, we're calculating how much fluids this patient needs per day based on their weight. So our problem tells us that our patient weighs 65 pounds. So we know right away we're going to need to convert that to kilograms. So 65 divided by 2.2 equals 29.54 kilograms. So now that we have it in kilograms, this part over here is going to make a lot more sense. So we're going to do our first 10 kilograms times 100. So we're going to do first 10 kilograms times 100 mils, which gives us 1,000 mils. We're going to do our second 10 times 50, which gives us 500 mils. So we've used 10 kilograms plus our second 10. So we've used a total of 20 kilograms so far. So I'm going to come over here and I'm going to subtract 20 kilograms. That leaves me with 9.54 kilograms. And that is going to be our remaining kilograms. So we're going to do 9.54 kilograms times 20. And that will give us 190.8 mils. And now to get our daily maintenance fluid, all we do is add those up. So 1,000 plus 500 plus 190.8. And this gives us 1,690.8 mils per 24 hours. Now, it may ask you to, what is it in mils per hour? Like, give me the mils per hour. And so all you would do is just divide those 1,690.8 divided by 24. So I'll give you 70.45 mils per hour if it asks you to give it in that way. But you're just going to read the question and figure out what it asks. These are super simple if you remember. Just the first 10 kilograms of their weight is always going to be 100 mils per kilogram. The second 10 kilograms of their weight, you're always going to multiply by 50. And then whatever's left, you're going to multiply by 20. So that's why it's also good to come over here and be subtracting. So after I used our first 20 kilograms, I made sure that I subtracted that out so I'd know how much is remaining. So that's all there is to daily maintenance fluid problems. They're super simple. Just make sure before you put your answer in at the end, you figure out if they want to know the mils for the whole day or if they want to know mils per hour. Now we are going to move on to pediatric calories. So these problems might seem a little much when you read them because there's a lot of numbers and details, but once you start working them out, they all kind of fall into place. So our problem says an infant drinks a 4-ounce bottle every 4 hours in 24 hours. How many calories did the child receive in 24 hours if they drink Similac formula that is 20 calories per ounce? So the first thing I'm going to do is, if this baby is getting a bottle every 4 hours in 24 hours, that means they're getting 6 bottles. So the first thing I'm going to do is do 6 bottles times 4 ounces. And that is going to give me 24 ounces total for the day. Now, it says how many calories did they receive if they drink a formula that has 20 calories per ounce. So now we know the total ounces that they get. Now all we have to do is multiply the ounces times 20 calories per ounce. And this will just leave us with the total calories. So 24 times 20 is 480 calories in 24 hours. And that is really all there is to those problems.